Hello, everyone. Welcome to another edition of the Compass Podcast. The podcast is going to come back online. We're going to be putting out some great content. We're really excited about that. And there's also a lot of other changes going on with Compass, and we're going to be going through some of those today. I have Nate, our nurse practitioner, who joined our team about 10 months ago with us today. And our podcast traditionally was just an audio format, and we're going to be moving that over to a video format. So we're going to be able to do some on-camera stuff with some illustrations, and I think it's going to bring a lot more educational content to our viewers. So first, let's kind of jump into what is Compass, who are we, what do we do? So my name is Dr. Lee Howard. I'm a board-certified surgeon, and about 10, 11 years ago, I started kind of on a journey of self-improvement, biohacking, and anti-aging medicine. And that has culminated in the development of Compass. And Compass is Nashville's most comprehensive regenerative medicine and anti-aging facility. And our goal is to help our clients live as long as they can with as much functionality as they can, and really to help them lead a better life. And so we see people across all walks of life, those who are maybe athletes or weekend warriors, or people who are your regular 9-to-5 people who don't have an athletic part of their life, but they're just looking to maintain their health and their performance as they get older. And so we work with people of all ages, men and women here, and we get to see a variety of issues that are associated with aging, and including musculoskeletal problems like bad knees, hips, and arthritis and stuff like that. So I'll stop there and then let Nate kind of introduce himself.
I'm Nathan Byrnes, certified nurse practitioner, and then also NASM performance enhancement specialist. My background's a little different. This is my second career. So originally went to college, have a degree in business management, emphasis in sports, and then got into the Air Force, and that's where I kind of fell in love with the medical field there. After I transitioned out of the Air Force, went and got my RN, was a nephrology nurse for a while, and then transitioned to nurse practitioner. Traditionally trained, so I was in traditional medicine, primary care, COVID vaccine, everything like that. And it's actually my experience in traditional medicine that got me into the functional side. I've always been interested in athletic performance, so that's something I've always been interested in, but also the functional part after I saw in traditional medicine, really the breakdown of that and the lack of education and really the lack of remedies that were happening in traditional medicine. Basically, you're prescribing a bunch of stuff to cover up the underlying issue, and no one was getting better. So knew that there was more to health than just like the traditional side, and COVID was kind of the catalyst for me to getting out of traditional medicine and now transitioning more into the functional holistic side. But I really specialize in peptide therapy, hormone replacement therapy, men's health, athletic performance, but I also kind of take care of the other issues in terms of autoimmune issues and whatever
heavy
we kind of
metals,
see
toxicity,
here.
yeah.
Mold, toxicity. So it's been a nice transition and something I love kind of doing.
So I think that Nate brought up a great point, which is why does Compass exist? We can talk about the desire for anti-aging and longevity, but over the last 2.5, 3 years, in my opinion, it's become very clear that there are some big gaps in the conventional medical system. Those of us who were on the inside, wasn't that hard to see that. I think a lot of people from the outside now see it. But there's been 4 big major sort of failures in conventional medicine just in the last few months. One was the whole COVID narrative has sort of gone by the wayside, right? Ivermectin is now a recommended treatment for COVID-19. We don't see any real benefit, especially in certain demographics, for any kind of vaccination against COVID. We saw that the data that allowed doctors to prescribe SSRIs or certain drugs for depression, that data has been now looked at, reviewed, and is false. So a lot of the people who were taking SSRIs may not have been indicated to take them. We know that the statin argument, the sort of desire to lower cholesterol with a drug, didn't really lead to reducing heart attacks and strokes as much as that was told to us. And then the other part of this was the drugs that were looked at, or the data that was looked at to support the drug use in Alzheimer's disease, things like Namenda and Aricept. So just in the last few months, all of these sort of like conventional therapies that are affecting millions of people, right? Statins and antidepressants maybe outside of antihypertensives, are the 3 most common groups of medicines prescribed. And the data around all of that has now fallen apart. So the conventional person out there is looking at medicine, or should be looking at medicine, scratching their head saying, I don't really know if I want that anymore. No. Right? And I think in our from my age group, I'm 46, from my age group and younger, there's a the amount of skepticism has grown tremendously in the last 3 years over the medical system.
Yeah, and I think, one of the biggest things that I saw as a fall of traditional medicine is the lack of education that patients got. Like, you were told that you take this pill, it's going to resolve this, and you just kind of went there and hey, that's what it is. Versus like here, we have the ability to take time and really educate patients on what is all going on in the body and how we can actually fix these things without ever being on medication and try to get you off of all those pharmaceuticals because of all the side effects that stem from it. I always say, I can extend your quantity of life, but your quality of life is going to suck being on these things. And you just kept coming in, the person was worse. And it's okay, well, now you have these side effects stemming from this pharmaceutical. Let me just prescribe this to cover it up.
Drug, yeah.
And then you have this polypharmacy going on and people not really enjoying life. Like, that quality of life wasn't there. Versus now seeing here, I've already had more success stories than I ever had in traditional medicine, like with the 10-month span, and really changing people's lives. So where we're getting them off of pharmaceuticals, they come in and they're like, man, I feel so much better. I'm not taking all these medications. And from a person, now we're extending their quality and quantity of life. And that's where traditional medicine really misses the boat. Now, there are still some, good theories and things that happen in traditional medicine that I agree with, but there's so much more outside, and it's that lack of education that patients have where they don't have control of their health and they don't understand what's going on. So it's really nice here is we break down your labs, we break down what's going on in the system and how you can do these things without ever being on pharmaceuticals and fix these issues. And so that's kind of been the breath of fresh air. And we talk about that younger population has really been seeing an uptick in terms of, hey, there are things that I can do to prevent myself from ever getting to the level of needing pharmaceuticals. And I can take care of my health now and have where I feel like I'm 20 into my 50s and 60s.
Yeah, that's right. And so I think what's happening, and so I just lost my dad, 7 months ago. And so we at our age group are now looking at our parents and going, okay, so you were on a statin for 25 years, you were on antihypertensives for 30 years, and yet you're still living this very miserable life where you're incapacitated because all they've done is take medicines that did not fix underlying issues. And we focus a lot, I tell people we focus a lot on 5 core areas, right? Sleep, hormone replacement, stress management, exercise, and diet, right? We give a lot of attention to those 5 things. And I truly believe that if you focus as a human being, if you focus and dedicate some energy to those 5 areas of your life, 90+% of the potential ailments, chronic ailments that can come your way are likely to be removed, right? Like we see this in practice. It's not like we don't have experiences to back that up. We also talk about a concept called targeted maximal longevity, which is in a lot of ways it kind of akin to Peter Attia's health span. I think is how he describes it. But the point is that you need to live a long, healthy life. It doesn't matter if you live to 85 if you're stuck in a nursing home for the last 20 years of your life. At least most people don't want that, right? Our clients certainly don't. So we really want to take that, and we take education serious. I'm glad you brought that up, Nate, because what we feel like is an educated client is an easier client for us to serve, right? And with us going through the extra time to empower our clients with more knowledge allows them to make decisions when they're not in a place to have the information or the time to look up or to determine what may be best for them. But we want to, through our time and education and our experiences, give them knowledge that helps them make decisions that may be otherwise something hard for them to do because they just don't know about it. Yeah. So let's talk about some new changes that are coming, right? One thing is we're going to be having a new office. For those of you who've been in our office, it's quite small, and we're going to be keeping our current space, but we're just going to be utilizing it differently, and we're going to be moving to an adjacent building. We're going to have a lot more capacity. Our space is going to be updated, and I think from a patient standpoint, it's going to allow us to see patients. We're going to have more room, so our wait times are going to go down, and we're going to be able to overall offer a better patient experience, I think. So we're really excited about our new office. We're actually slated to move in about 48 hours. So by the time this gets out there, we'll already be in that spot. Now, another interesting thing that we've got is a thing called the Gallery test, right? And the Gallery test is a blood test that looks for cancer DNA or proteins inside your blood. I think there's like 46 different cancers that we check for, 47, something like that. Anyway, Very few cancers actually have screening tests, right? We can look at things like cervical cancer, breast cancer, colon cancer, where we have screening measures. And those typically find a cancer once it has formed. We in the medical profession are looking for ways to diagnose and find cancer earlier. And one of the ways that has been shown to work is by looking for cancer DNA or proteins in the blood. So the Gallery test takes a blood sample, looks for DNA or proteins associated with these 46 common cancers, and then tells us if you're positive or negative or not, right? So I think every test that we've done so far has been negative. Is that right?
Yep, everything's been negative so far. But yeah, it's a really good tool that's new, and Gallery's kind of a new tool to use, but it's going to catch it. I mean, early detection is kind of the key to treating cancer.
Increasing survival, right?
And increasing survival. But what this does is this takes it a step further than that. And like you said, just looks at like those spike proteins or the DNA that's starting the process of the cancer, so that we can get that diagnosed early on to where your survival rate is, percentage-wise is way higher than what they would normally detection-wise would catch it at in
That's
stages
right.
with cancer. So it's an expensive test right now, but you got to think about it from a health perspective, like the cost that you're saving if you did have a cancer, just knowing, especially if you have like a family history of stuff like that. It's so important to get that early detection. And I always say, like, how much do you want to invest in your health? These are one of the tests that I think is very beneficial to kind of spend your money on, because
Right.
it's going to tell you, hey, this is where you're at when it comes to cancer. If you ever have, like I said, you've had a history of cancer in the past and worry about it's kind of coming up, this is going to catch it really early, and it's a really cool test.
Yeah, that's right. So in theory, right, early detection, better survival rates, hopefully less surgery, less chemo, less radiation, right, less toxicity, easier recovery, better long-term survival. So basically how this works, guys, is well, first of all, Breast Cancer Awareness Month is for the month of October. And many of you who are viewing this podcast will probably see an email kind of alluding to the fact that now if you're a female specifically with high risk, maybe a family history of breast cancer or some sort of other breast pathology, then you may want to consider getting this test done. And the way this works is if the test comes back positive, meaning that it found some sort of DNA that indicates that you may have cancer, then what we do is we meet back with that client. We start to look at what test do we now need to order to look for that type of cancer, right? So if it comes back as we believe there's a breast cancer, then obviously we're going to start with things like mammograms and ultrasounds and maybe a breast MRI after that's done. But we would start to look for where those other cancers or where that cancer would come from. So if you're interested in that, please call our office. We'll have a link in the show notes or in the footing here that you guys can access to learn more about the Gallery test, as well as call our office to get that scheduled. I want to say the price is $1,200.
I think it's $1,200, and I think we met with the rep, and if a lot of people are like interested, we'll have a day set aside where they come out. They have a phlebotomist there, and then we just have like basically a van or whatever that we utilize, and we can just kind of get people knocked out that day. We're kind of planning October around that if we get like enough people interested in that.
Yeah.
Yep. And so if that's something in the future that's kind of down the pipeline too, that we'll have them kind of come out if we get enough people that want a specific
that are looking
draw
for it.
that.
That's right. Yeah. So now let's talk about a program that we implemented not that long ago. I don't know, 10, 11 months ago, right when Nate kind of started with us. And the number of people, the number of young men specifically that need hormone replacement therapy is growing. And it's growing, I think, for a lot of reasons, right? I think that guys are more stressed now than what they were 20 years ago when I was a young guy. I think that there's a lot more environmental toxicity that's contributing to this. I happen to think that video games are playing a big role in it because these people stay up late and it's just a chronic like ding on your cortisol in your brain. But what we found is that these young men are struggling, and hormone replacement therapy as a youngster can be a little bit more expensive. And so what we wanted to do was provide a way for men under the age of 35 to have access to testosterone replacement therapy, and it doesn't break the bank. And so we wanted to come up with a simplistic way to operate that program. And so we've kind of, Nate has pioneered this and really, put this in place for us, and he's the spearhead of this effort. But our goal is to open up a testosterone replacement therapy program specifically for males under the age of 35 that allows you to have testosterone therapy in a cost-effective manner with an experienced provider, right? And this is a little bit different than our other plans and our more sort of expensive plans, mainly because we are not, we're not so involved as we are with some of our older clients, right? Where we're seeing them twice a year in the $99 program. We typically will see them on on a yearly basis, right? An annual basis. And so I want to give Nate just a few minutes to talk about that, because he sees a lot more clients in this position and how this has changed their life. And y'all listen, I believe that testosterone is probably the most underrated drug in the entire world. From a therapeutic standpoint, there's very low risk and a huge amount of potential upside. So Nate, share with us like what you've seen so far, right, and working with these young men.
Yeah, so I get a lot of young males in here, either athletes or just day to day, that come in and they have the symptoms of low testosterone, or hey, I'm not.
And what is that? Like, yeah, tell me what's the most common thing?
There's so many things. So a lot of people like kind of put testosterone in this corner of like libido and muscle mass, right? And that's kind of like, hey, that's where they think of testosterone. And testosterone does so much more for us than this. So as I always say, that's like a really small part of testosterone. Yeah, that's the nice part there, but testosterone does a whole lot more than that in terms of like our immune system. And somebody has like fatty liver disease, it can help regulate that, helps regulate the thyroid. So it does play a huge role in all the systems on the body. And we can even dive into like the mental health aspect of it. But more and more I get individuals younger age, hey, I'm depressed, I have anxiety, or I'm fatigued, I have this chronic fatigue, I'm not able to kind of delayed muscle recovery. It's all these like symptoms that we don't really think about, and we just kind of chalk it up to stress in life, or hey, I'm just tired and that's how I live life. And more I get these test results back, and I have 18-year-olds, 24-year-olds, and their total testosterone's in like the 300s, and their free testosterone's like 1.7 to 4.7, and they have these low numbers. And like you said, 20 years ago, that's not a common thing. And I think a lot of
we didn't really look at it.
Yeah.
And, it wasn't a topic of discussion really.
And you look at like the environmental factors now, the more, the food is injected with hormones, and the topical stuff you put on affects hormones. And we talk about video games. We live a more sedentary lifestyle. We talk about not getting out and exercising. Our diet's crap. And all these things kind of suppress testosterone, especially like cortisol levels, sleep, all that stuff suppresses testosterone. And so we came up with this plan, like, well, these individuals are struggling with this. There's got to be something out there where they feel like the age that they should feel, right? And so we started the Hrt program, and not only do we kind of talk about testosterone, that's kind of the last part I want to, put something on if I don't have to in terms of age-wise, but we look at like peptide therapy, and we look at, something like HCG to stimulate, or, what are the factors that are causing this hormone to be low. So it's more than just putting someone on testosterone. We kind of treat them as a whole to kind of, ramp them up there. And so, and we have other things working with that program as well in terms of, peptides and IV therapies and stuff like that to kind of really get people optimal. And complement in that aspect of it. Yeah, testosterone gets that bad rap, and it really has to do with getting you to the optimal level. We're not shooting your testosterone through the roof where, it kind of gets the bad raps with like bodybuilders and, oh, it's going to stem like all these side effects. Well, if you kind of get you right to that optimal area, those side effects are not really there, and it's more have to do with being able to manage it correctly and looking at estrogen, looking how someone aromatizes estrogen, and making sure that everyone's different in that realm of how they absorb testosterone. That's where we come in as professionals and take it that next level in terms of really treating you as an individual, not this umbrella, and making sure that you're optimal and that we're not messing with those levels.
Yeah, there are so many things that we could do a whole podcast on to what you just mentioned, right? So like, one thing, what are the compounds that are, so I've got 12 and 14-year-old sons, right? So we use certain deodorant. We don't drink out of plastics unless we have to. We avoid soaps and shampoos with parabens and phthalates in it. So, and those are the big ones that kind of can disrupt testosterone receptors. Another one is plastic. Plastic is probably the worst one, because once polystyrene plastics bind to a testosterone receptor, it's irreversible. So until that cell dies and is replaced by a new one, there is no interaction of testosterone with that cell. Another thing that you brought up was the environmental factors, right? And how this is kind of changing, and video games and stuff. And so toxicity within the environment and food. And we work with our clients to sort of help them understand what the underlying nature of this is and why it's happening to them. So anyway, but the point is that if you're a young guy, you're listening to this, maybe you got a friend who seems like maybe they have some health issues or concerns, or it's your loved one or something. There are solutions out there to help younger men get testosterone replacement therapy. And I think that, as Nate mentioned, there are several warning signs, if you will. I like to tell my clients, my male clients, that if you are not waking up with a morning erection, probably 3 or 4 times a week, that in my mind is probably the most sensitive indicator that your testosterone is low, right? And so we talk about, with our clients, we talk about what's the form is. The form is really what's on the paper, right? Your number that came back on the lab test. And then you have the function, which is the individual setting in front of you. And as clinicians, unfortunately, so many clinicians nowadays just look at the numbers. And they don't consider what those numbers are telling you about the living, breathing individual in front of you. And that's what separates us out, right? Because we're more interested in your function, and the numbers become part of your story, not the story. And so what we're here to do is to move the needle, to move the outcome in a tangible manner for our clients. In other words, we're a results-oriented practice. Our goal is to get results for our clients in all areas of their life. And the $99 program has allowed us to open that up to a group that otherwise I think may not have had access to some of those therapies.
Yeah, and I had just a ending note here. We talk about what is normal testosterone, and you're going to go to your traditional doctor there, which traditional, they tell you don't mess with hormones. Basically, I can tell you that right away in schooling, you're not messing with hormones. But you kind of look at a lab, and traditional wise, a normal testosterone, total testosterone, is anywhere from 280 to 1100, and a free testosterone anywhere from like 4 to like 25,
21,
yeah,
23, whatever, yeah.
But I can tell you an individual at 500 feels totally different than an individual at 1,000, right? And
Absolutely.
You're still within that normal range. So they'll tell you, hey, you're normal, right? And we can talk about sex hormone binding globulin and how that plays a role in free testosterone, which is the most important thing, that free testosterone aspect of it. But just as an example there, you might go into and get labs and your doctor's like, oh, well, your total testosterone is 500, you're totally fine. And you think you're normal, but that's really not normal.
That's not normal.
Yeah, they just start widening what's normal because it's fitting the bell curve of what more and more people see.
Yeah, and so to that end, right, I think both Nate and I look at it and say, if we got a testosterone level of somewhere between like 1,000 to 1,300, 1,100 to 1,300, 1,200, somewhere in that range is where 99% of men they're gonna kick it like a three-legged ninja, right? Yep. And it's not uncommon for our male clients to double their income in the 18 to 24 months after starting testosterone therapy. And so many of them look at me like I'm crazy when I tell them that. But it really does happen, because they'll come back in 18 months. Maybe they'll show up with some kind of gift. Maybe they'll send me a nice email, whatever it is. But they recognize in the last 18 months that they basically passed their personal productivity goals.
I can't tell you how many patients text me like, man, I feel like a new individual. Like you said, work life is getting way better. Home life is way better. Sex life is way better. Everything's much better. I always tell my individuals kind of like bringing that alpha energy back. But yeah, more and more like success stories. Like I can't tell you, like I said, so many people text me and they're like, man, it's changed my life, right? I feel like I did back then. Like I actually feel good now, and it's changed every aspect of their life. So yeah, like I said, I think testosterone is one of the most, looking at hormones in general, is one of the most underrated things in medicine, where we kind of miss the boat, especially traditional.
That's right. And so to that end, I don't have my little diagram. It's probably on our website somewhere, but basically we have this little pyramid in the office that I show my clients, right? So it basically has several, I think 7 levels to it. But the point is that the base of the pyramid is built upon, first, a diet, and second, a hormone balance, right? And so if we look at the strategic value of having a proper anti-inflammatory diet that meets your metabolic needs, right? Your macros are good, and you have a hormone balance that is appropriate, right? In other words, we're not allowing certain things to just go unchecked. Then that sort of foundation then allows us to use things like IV therapy or peptides in some cases to get much better results than just, say, diet and hormones alone. Now, some of our clients want to just stop there, right? Like that is enough for them because they're hitting the mark, right? They feel so much better. Their life is infinitely better than when they started. And so they don't need to go, spending more money or doing more therapies because we've kind of gotten them what they wanted. And that's refreshing to see too. But the another thing we want to move on to here, guys, is showing you some supplements, right? We're going to start to highlight supplements on the podcast and through emails and some other things. And as most of you know, we're not really big supplement people, right? In other words, we don't want our clients walking out of here with just an armful of supplements. We typically prescribe supplementation for strategic purposes. We have a couple of things that we use routinely. We're big on vitamin D here. fish oil, turmeric, some other things that we recommend routinely. But as a general rule, giving you a bunch of supplements is not what we're in for. We focus on whole food nutrition, strategic supplementation. But we do have a couple supplements that are good for everybody to kind of know about, right? It's sort of like you should know what Motrin does, so if you ever need it, you can go get it.
Yeah.
And that's where these come in. So we're going to highlight 4 supplements today. The first one's going to be Estrodim, right? So Estrodim here, this is a combination of DIM, diindolylmethane, and another compound called indole-3-carbinol, or I3C. And as a male, I give this to clients. I take it myself. I use it in females of all ages. Obviously not the postmenopausal group, but in the younger females, like I talked to a 17-year-old girl yesterday who's been taking this for about 5 months now. Her acne is totally gone. Her periods are normal, coming every 28 days with no PMS, no other side effects. Like, oh wow, my doctor prescribed me a anastrozole as soon as he started me on TRT. That's kind of a reflex thing that happened like 20, 30, 40 years ago. I think that the science now, at least in our opinion, in our practice patterns, doesn't necessarily support the routine use of anastrozole. We typically watch our clients, advise them on the factors that we have seen increase their likelihood of developing high estrogen, and then first control those, and then we go to something like Estrodim once or twice a day to kind of help. But great supplement for men and women. Most women are estrogen dominant, by the way, so I believe that most women can take this once or twice a day and see their menstrual cycles improve. If you're dealing with something like PCOS or endometriosis, which is typically fueled by estrogen dominance, I think you should consider taking this supplement. And specifically as it applies to women who are going through their early 30s or so, when you start to lose progesterone and estrogen is still a dominant hormone for you. That is when I see most of the, I see the biggest benefits from the Estrodim. So look that up. All right, that's good. Now let's move on to glutathione. So we got glutathione a couple ways here. I think this is we have an IV version, right? And then is the other one, is that the liposomal version that we have there?
This is the NAD.
NAD,
but we have
okay.
one that looks just like this.
We have a
same bottle.
liposomal glutathione, right, which is really good. So basically, glutathione is your body's most powerful intracellular antioxidant, right? And as we get older, it just gets depleted in your body in general. And so taking an oral form of either N-acetylcysteine or glutathione can keep your glutathione levels up. It helps you deal with stress, detox meds, detox bad foods that you eat and stuff. But the most powerful way to get glutathione is intravenously, right? And we typically do a 2,000 milligram IV infusion of glutathione. And for most people, we recommend this about once a month. They come in and get a 2,000 milligram dose of glutathione. I did 2 of them just before we started the podcast. I mean, not me personally, but administered 2 of those infusions for two women. And you just don't see side effects. Maybe some people get a little flushing in their face. I typically do. But you can get a glutathione infusion in 10 minutes or so and be back on your way to shopping or whatever it is you're doing that day. And it's not something that you're going to wake up tomorrow and say, boy, I sure am glad I did that. You're not going to maybe notice that, but when it will pay dividends for you is when the stress rolls in, whether that's a sickness or some work, something or whatever, your body will fare much better, specifically if you use this over the course of time, right? And if you're supplementing it orally and getting the intravenous version, then you're going to see a much better result from that. Did you have anything to add about glutathione, Nate, that you see?
Yeah, I think you hit it on the head there. I always recommend individuals get like the IV because you get the 100% absorption going through the IV route. So just an IV push, and then I always put them on liposomal glutathione. Is more like a maintenance. That's where you kind of see the best results, keeping those glutathione levels up. But it does tremendous things across the board. I'm a big fan of glutathione. When you're sick, it's great. Really helped me get over COVID. When I had COVID, I did glutathione and basically immune drip, and the next day I was good to go, and I felt like death when I first had to go back in December when it was kind of hitting heavy there. But it's really good for skin health. Individuals that I put it on, they said, man, my workout's kind of next level. I have like more aerobic capacity. They just feel better overall. It's good detox, basically.
Yeah, that's right. So now share with us about NAD Gold. Pull that up here, Nate, and And tell us what
Yeah.
you've seen with that.
Yep, so NAD Gold here. So there's so many different NAD supplements out there, and we talk about what NAD is used for, like mitochondrial rejuvenation, right? And we talk about ATP is what our body utilizes for energy. And we can kind of go down, if you think back like 5th grade biology, you're gonna learn about the Krebs cycle there, and you're like, I'm never gonna utilize this. But what happens with the Krebs cycle is whenever we eat, so proteins, fats, carbs, is converted, and it starts basically the Krebs cycle there, and through the Krebs cycle we create 2 ATP molecules. But off the side of that, we create NADH, and paired with oxygen and some other stuff, you're able to create more ATP molecules, about 6. So what NAD there is for that energy, right? That mitochondrial rejuvenation, which is the powerhouse of our cells. If we kind of go back again in the 5th grade biology, kind of break it down, layman's terms, basically this is going to help with the mitochondria kind of produce more energy in that span, help produce more ATP, which is going to help every body function in general. So NAD Gold is great. We utilize that one. We have some other ones that we utilize. I'm a fan of this and NAD Platinum because it is the liquid form, and I just think it absorbs better and not in the GI tract. And help kind of boost your NAD levels there. And so NAD's does a lot of things for us, especially like the IV. Again, IV is better than this in general.
But it's a good supplement, right? When you're doing a 6-week NAD course, that's what you need to be taking to sort of support you on the off days, because you're only getting an NAD infusion once a week. And so we're using this as a supplement along with an IV, usually, not always, but usually with an IV form of the therapy to make sure you're getting the best results.
And NAD can get very expensive. It's a very expensive product to have. So, individuals, it might not be feasible to come in and do an NAD drip, once a week. And so say, hey, next best thing, let's get those levels up. And this is more cost-effective approach for someone who's like, hey, I just don't have the time or the money to come in and sit through an NAD drip. And so this is really good because we try to fix people from a cellular level. And so we just kind of do a cellular overhaul. And this is always part of my kind of protocol when I'm trying to hit people at a more cost-effective way, not able to come in through IV, or people who come in out of town who don't have access to those things. This is usually a big part of my protocol in terms of kind of fixing them from a cellular level.
Yeah, and as Nate was saying, how critical NAD is to the cellular energy production process. NAD exists in, I don't know, something like a half a dozen different forms inside that one little spot inside your cells. And to take it a little further, right, we spoke about how the IV forms of NAD are more potent. And a lot of times what we will do is we will combine NAD Gold along with the intravenous form, and then we have a few other supplements. I think there's 6 of them that go with our mitochondrial rejuvenation protocol, because as Nate said, right, NAD is one of the components that allow the mitochondria to produce the energy at the normal rate. And what we want to do is give as many of those other things, those complementary factors, as we can. So we've developed a supplement protocol that goes along with the intravenous protocol so that we can really round out all of the things that your mitochondria need. And all of us, guys, I'm telling you, everybody can benefit from NAD IVs, because all of us are going to experience a decline in NAD as we get older. And the more stress that you've endured, if you've been sick, maybe you have some other sort of thing, like a chronic illness, type 2 diabetes, something, we could go on and on and on.
Yeah.
But the point is that NAD has a tremendous ability to heal your cells and restore your body's ability to produce energy. And NAD Gold is one of the things that we've seen make a big difference for folks. So last here on our list of supplements to talk about is BPC. And I tell you guys, this is probably one of the most interesting peptides that we use, right? And I think it's probably the most common peptide that we use, maybe outside of HCG or something. Mm-hmm. But I'm going to talk about the discovery of BPC, and then I'm going to let Nate kind of jump into some of the clinical aspects. So the discovery of BPC came in like the early 80s when these researchers were looking at how does a stomach heal an ulcer. Kind of a unique concept, because the stomach acid is 2. Normally a wound or an injury would not heal with that low of pH because it would kind of aggravate the wound. But yet the stomach heals itself. And so these researchers came up with BPC 157. And so this is a very potent anti-inflammatory and healing peptide. And it has really probably as many uses as you can think of. If you can find a way to administer it, it will probably be effective. So intra-articular use, right, with joints, snorting it, like nasal application of it. We use that as an anti-inflammatory treatment for kids who have like autism or autism spectrum disorder. We use orally and stuff. So Nate, now take us further on that realm. Like, what's the way that we use this?
So, like you said, we utilize it in a lot of different forms, anywhere from injections to IV infusions and nasal sprays. And we'll kind of highlight kind of the most common stuff that we kind of use this for. And this is going to be in pill form. And we use this in pill form particularly for GI stuff. So we have a slow release and we have a rapid release. And why BPC 157 is good in pill form for GI stuff, because most of the absorption is going to happen in our GI tract. So for instance, the big difference between the rapid release and the slow release, you can kind of break it down: upper GI, lower GI. If you have a lower GI issue, something like IBS, Crohn's, all that kind of stuff, then you want to take the slow release BPC 157, versus if you have like GERD, heartburn, then you want to take more of the rapid release, because that's going to resolve that issue. What's cool about BPC 157 is we're actually fixing the issue, the damage that's been done, versus masking it with proton pump inhibitors like omeprazole. So me, myself personally, I had experienced really bad GERD, was on omeprazole for a long period of time, started taking the rapid release, and in 3 months got rid of the GERD. I'm off of omeprazole, haven't been on it, and haven't actually taken BPC 157 rapid release since then. Fixed my GERD, and it's been amazing ever since, and it hasn't come back. I have a lot of individuals, I treat a lot of IBS, Crohn's, that kind of come in here, diverticulitis or diverticuli, and I'll have these, massive issues. And one of the protocols I kind of put them on is that slow release, with other things, but that slow release. And I can't tell you, every time someone calls, they're like, man, I feel totally different.
Better,
and I've been having, this issue for 10 plus years and gone through all these different doctors, tried all these medications. And in the span of 3 months, you made me feel better with this protocol than I ever did on all these other medications. So it's such a powerful peptide, and I love peptides. I can talk all day about peptides, but it's such a powerful peptide. And we kind of highlight the GI system here. You do get some systemic benefits from it too, just not a big absorption rate on that. So it can still help with like joint pain and stuff, but usually I stem that for like IVs and things
or
along
local
those
application,
lines.
right?
Yep, and local application, versus like particularly dealing with the GI system. I really like the pill form, because that's where all the absorption's happening.
That's right. And we even combine these gut health supplements, right, with other gut health things, right? So we say, if you got leaky gut, right, using the rapid release version would be good, combining that with a probiotic, and then maybe taking some collagen to help rebuild the gut lining and restore the integrity of the gut. So BPC is a great supplement, guys. It really has a lot of applications, huge safety profile, right? The data says that most of us can take astronomical amounts of BPC and have no side effects from it, like 10 milligrams per kilogram. So we know that this has the potential to heal a lot of sort of altered systems throughout the body, and we've just seen great success with it. So that kind of concludes my list here. Nate, was there anything else that you wanted to talk about while...
No, I was going to let individuals know. I think me and you both, we basically use ourselves as test subjects for everything that we talk about. So we have a firsthand experience for most of this. And that's why, I talk to my patients, I tell them firsthand experience, hey, I did this, these are the results I got. So I think that's what separates, us from other individuals too. Like, yeah, we can read this stuff in a book and we can regurgitate or word vomit this stuff to you and sound all nice. But I think me and you both...
It's the experience, yeah.
Goes down the route and see the safety of it, see if it's beneficial for you, because we never recommend anything that's not going to be beneficial. So I think we make it an important part for us to kind of try everything, especially anything new down the line, and experience it ourselves, so that we can really tell our patients, hey, we do this stuff too.
Yeah, that's right. I mean, if I haven't done it, I've probably either injected or done. One of my family members has done it too. You know what I mean? Something like that, or one of my friends that I got them to do it. But yeah, we'll have to share the story one day about how we started doing NAD with just pushes and stuff, and how we kind of self-experimented with that. But it is important to us, because I think I didn't really say it like this in the beginning, but I started to feel bad as a regular doctor in 2010, 11. And I knew that if I went to my regular family practice doctor, that I was going to get this canned answer. Maybe you work too much, maybe you're depressed. I didn't think I was depressed. Working too much was true. But the point was that I knew that the solutions to my problems were not found by trying to treat those possible causes, right? That if I went over to my regular doctor, the crap that I was going to get wasn't going to move the needle for me. And so we've made it a point over the course of the last 5 years since Compass has existed to use ourselves as a guide to what our customers want and what our customers are going through, because we're normal, healthy individuals, and if we're struggling with something, it's highly likely that somebody else is too. And so we we take the advantage of being here and in the area where we can experiment with these things, and we take advantage of that and do it, and then we use those results to help our clients out. So I'm really excited to get the podcast up and going. I think it's going to be great for us. By the time you guys see this, we'll be in our new location. We'll be having a grand opening. We're going to be sharing some more news about some changes that we're going to be making. We're going to be restructuring some packages and having more exclusive offerings for our clients and giving you guys, our audience, our client base, more ways to interact with us that are hopefully going to provide more value for you and allow you to access our services in some easier and easier ways that are going to result in better outcomes for you guys. So Nate, thanks for joining us today on the podcast, and we look forward to seeing you guys again. Hopefully in another couple of weeks we'll have another episode out. So please stay tuned for that. Stay tuned for some information on our new location that's coming up, and we hope to see you guys again soon. Thanks for listening in today.